ice is a major issue for trainees who don't understand how to ask it in a conversational way. So share with us the difference in how you were asking it before and how you change it.
For example, if someone is coming like with a back pain and I have already primed my case and I feel it is a back pain and probably it will be like some physiotherapy and XYZ and some letter for workplace, for example.
Mm-hmm.
I'm Dr. Bilal or Dr. Asim. What can I do for you? And they're telling, oh, doctor, this pain is awful. And then I was saying, okay, it really sounds that you're in pain. Tell me more about it. And then the moment he's telling that I have to wake up in the morning because I drive and it's getting difficult and XYZ. And then I was not asking, okay, what is your idea or what is your biggest concern? So I was asking them, okay, it sounds really hard for you. You have to work for you and your family. It's really tough thing, I can already see how much this is affecting you. And then even me, without me asking them that what is your biggest concern, and they were very happy and telling me, doctor, spot on, yes, my worry is that if these things can happen, they may just I work for a company, they just discard me, they fire me out, and I am under big mortgage issues and I don't know what to do. And now I knew that I need to give him a letter for some amendment and maybe signpost him for some help with his mortgage, some social prescribing, without even asking that, okay, with this back pain, what is your biggest concern? Uh, and another thing, when I was asking the last word of the eyes, the expectation, if someone is coming with the weight loss or back pain, this time I was not asking, okay, what you are hoping that I can do for you, or when you are coming to see me, what was in your mind that I can help? No, I was telling them that, okay, I know how much it is really, really difficult to have this back pain. Other than that, I will help you find out what is best way ahead, John. Was there anything else in your mind that I could help you today? Because my worry was if I ask that, okay, what you are hoping that I will do, and it looks really, this is not very nice word, but it looks a little bit stupid, that patient will think that, okay, you are a doctor, I'm coming with, so you should know why I'm here. I'm in so terrible pain, so this is the way I was a little bit adding, just to remove that confusion for examiner as well, that someone is coming with a weight loss and asking, okay, so what is the best way you think I can help you? So I was always relating their expectations, but asking extra expectation if there is any.
That's beautiful. So you are having that conversation with the patient, and the patient feel heard, and they open up naturally with you because you build that trust. So let's move on to actually management. Were there anything that you're not doing right in the management that you changed?
Coming to the management, as I was doing good on relating to others this time, so it automatically give me more marks in the management. Like, I had to make that patient feel that they are the most important person in that consultation or room or whatsoever, not the examiner, not myself. So what I was previously doing was that if someone is less than 55 years of age and hypertensive, I was telling that, see, anyone who is less than 55 years and you like blood pressure high like you, we give ramipril, it may give you dry cough, etc. No, that is a blanket management. I have to make him feel special. So this time I was telling that, okay, if someone is less than 55 years of age and they have same blood pressure like you, we normally would give tablets, but what are your thoughts about taking tablets? And then not just asking and then moving into next question, then just listening, giving them some pause. Okay, take your time. So, and then I found that, yeah, some patient immediately told, yes, doctor, I think that is very reasonable because I'm already doing good diet. I don't take any salt. I do exercise. And if my blood pressure is still high, I think it's a good. So what is tablet? Tell me more about it. And some other patient were telling like, no, doctor, I'm not a big fan. Is there anything I can do from lifestyle point of view? And then I was telling, okay, what they can do. So in this way, I was keeping them most important person. I was making it to feel that they are not, they don't keep what is the treatment for blood pressure for everyone. They care what is best treatment for them. So I was asking them, I was making it more like a, you kindly used to tell us wrap, you told us gift wrapping. When we give management, make it special for them, make this gift for them, cover it, make it, mark it, give it to them. So that is how I changed my management, and I marked more higher than ever before.
You gift wrap and present the management plan that feels tailored to that individual. So I'm glad that you brought that up. So if right now you're not sure how to get good marks in management, I hope you can use that insight. And if you feel like so far you've been enjoying this podcast and you know somebody who may fail the exam or struggling, feel free to share this podcast to them. So now let's move to on the day of the exam, how did you prepare? Because sometimes it can be quite nerve wracking if you're sitting it for your final attempt.
I'm glad that you did ask this. So this time I purposefully started my preparation some 3.5 months before my exam. So I knew exactly that for 3 months, day and night, I have to work hard, but in a right way. Because I worked hard last 3 times as well, but I couldn't pass the exam. And the last 2 weeks, what I had to do was that I had to like waiting for that day when the exam comes. So last time it was like whenever the 2 weeks were remaining, I was a bit more nervous that only 2 weeks remaining. I have to do a lot of revision now. Oh, another now 10 days remaining. I'm also doing my job, and I was getting that more and more and more nervous feeling. But this time, even my wife asked me that, what made it different? You are a different person this time. When it was 2 weeks remaining. So why are you not worried? And I told, see, why I need to get worried. I work day and night for this exam, for this day. I'm eagerly waiting for this day to come. That is why I spent my days and nights, and I did a lot of sessions with yourself, and I did practice with my other two colleagues you had signposted, and same mentality I kept, and I was so happy this time. I was able to sleep night before exam. Previous 3 times it took hours to sleep, but this time I told, uh, okay, this is the day I worked hard. This is the day for me to show how much I have changed myself. This is the day to win it. So I went there, and I went like 1 hour before just to make sure my everything is all good. And then I sat there and I was waiting, and I was telling me that this is an other only 12 patients. They are like colleague or friends. I will enjoy this. I will make it conversation. I don't have to write like a real life, some prescription even. I have just to verbalize it. Take it easy. It's not end of the world. I'm going to pass this. But yeah, of course I'm human being as well. So 15 minutes, because when my check was done, they told it will be another 20 minutes, Dr. Bilal, and then you will be on the go, and you are being watched, and just wait there. And then 20 minutes, yeah, I had some little bit start of little bit adrenaline or little bit, but I knew what I need to do that.
If you found this video useful, you might want to watch the whole interview here. Click here to watch it. Take care, everybody. Bye bye.